I am a professor in the School of Epidemiology and Public Health at the University of Ottawa. I'm the director of the Insight Lab, our interdisciplinary spatial informatics for global health lab, which is a bit of a mouthful, but we do a lot of different research projects on the spatial ecology and epidemiology of vector-borne diseases, including diseases transmitted by ticks, like Lyme disease. And so we're here today partnering with the Kanata Lakes Community Association, which is a member of our Community Advisory Committee for the Uptick project, to share a bit of information about the project and the research that we've been doing in communities like this around Ottawa for the last 5 years, and to share a little bit about what you can do to prevent tick bites. And we have some other wonderful guest speakers here to talk a bit more about what you can do if you're bitten by a tick or if your pet is bitten by a tick. I'm here with my colleague, Dr. Roman McKay, who's my lab coordinator, and we'll be passing back and forth to give some information tonight. In terms of questions, should we hold everything to the end, or shall we have questions after each talk? After each talk, and then we can move forward. Perfect. Okay. So today I'll talk a little bit about ticks and Lyme disease, just to give some background. Talk about some of the local tick research that we've been doing at the University of Ottawa with my lab, go into a bit more detail on the Uptick project, and then talk a bit about how to prevent tick bites. So there are a number of different species of ticks in Ontario. There are about 8 to 10 different species that tend to bite different types of animals. The two most common species that we find in Eastern Ontario here are the Ixodes scapularis tick, or the black-legged tick. You might have also heard it called the deer tick, and Dermacentor variabilis, which is also called the wood tick, or the American dog tick. So the ones that we're really concerned about here are the black-legged ticks, or deer ticks, that can be vectors of Lyme disease. These vectors, ticks, come in different sizes according to their different life stage. So you can see here on the end of a finger what the adult female, adult male, nymph, and larval ticks look like. And here's the ticks when they're engorged after they've been feeding on a host. These ticks are mainly found in deciduous forests or mixed forest habitats because of the animal hosts that they feed upon. So deer, and then at the juvenile stages, smaller mammals.
Can we get lights off?
Yes, maybe that would be easier.
Actually, probably better.
Thanks, Rob.
If you just lowered the thing because it's getting lost in the band at the top.
Yeah, I think it's a bit out of focus on this side. Is that better? Yeah. Okay.
Much.
So mainly found in areas with white-tailed deer and small mammal hosts, and I'll go through some of those in subsequent slides. These ticks, they don't fly or jump. Like most ticks, they seek their hosts by what's called questing, and I'll have some slides about that as well. So this is the life cycle of the Lyme disease bacterium. So it's a tick-borne bacterial disease with rodent intermediate hosts. The eggs are laid in the springtime. They hatch into these small larvae. In the summertime, these larvae are not infected. So when they hatch from an egg, they're not infected with the Lyme disease bacterium, but these larvae can feed upon small mice, chipmunks, other small animals like certain types of birds, where they can, if that animal is infected, acquire the infection. They then overwinter and emerge as the next stage, the nymphal stage, in the springtime. Usually they start to come out sometime in June, and they're active through to the end of July. These are the stage of ticks that we're most concerned about for transmitting Lyme disease because they're very small. If you recall the previous slide, they're about the size of a poppy seed, so very difficult to detect if they're on you. And they bite a wide range of hosts, ranging from, again, small mammals up to larger mammals, and humans and your dogs and cats. So this gives the first opportunity for these black-legged ticks to feed and transmit Lyme disease, but the adult ticks also are active in the fall, and in the subsequent spring, if they haven't found a host, they can also transmit Lyme disease. So these are the very the higher risk periods for acquiring Lyme disease or being concerned about tick bites. So this is an image of a male black-legged tick questing. You can see they go up to the end of a branch or a leaf, a piece of vegetation. They wave their forelegs in the air that have the chemoreceptors that are able to smell a host and seek to attract the CO2 and the heat. And they're able then to latch onto any host that they may brush by. So you really do have to brush along the vegetation in order for these ticks to get onto you. Mice, chipmunks, and other small mammals serve as the hosts for those juvenile stages that I mentioned, the larvae and the nymphs. So places where we find white-footed mice are areas where we have higher Lyme disease risk. White-tailed deer again, these are the main hosts for the adult ticks. So the male and female ticks actually find each other while they're on a white-tailed deer, and then this is where they mate. So it's really a key species in the transmission cycle for Lyme disease. One of the things that we do in my lab is study different risk factors for Lyme disease, so including things like tick ecology, their life cycle, their distribution, how they're colonizing different environments. We also look at pathogen dynamics, looking at the transmission cycle, the infection rates in different types of animals, for example, and human exposure. So what are the different risk behaviors that lead to infection with Lyme disease? How can improving knowledge, different attitudes towards preventive measures, et cetera, increase or decrease our exposure to ticks? So I'll just give a little bit of information about Lyme disease, although I won't go into it very much. And I'll put the caveat, I'm not a medical doctor, I'm a medical entomologist. So happy to answer a lot of questions about the ticks and ecology, but I will leave the clinical questions to other experts. So Lyme disease typically comes in three main phases. Immediately after a tick bite, you might start to see a local reaction at the site of the tick bite. If the tick is infected and remains attached for more than 24 to 48 hours, it has the opportunity to transmit the Lyme disease bacterium. If the tick is removed within 24 hours, there's a very negligible chance of that transmission occurring, because it does take a while for the tick to be attached before the bacteria can move from the tick's gut into its salivary glands and then be injected into a host. So if that tick remains attached and is able to transmit, one of the first typical signs is what's called an erythema migrans rash, which often looks like a bullseye. So it's called a bullseye rash with these kind of expanding concentric circles. It doesn't always look exactly like this. So it can look like a flatter rash or in other patterns, or in some cases, it doesn't appear at all, depending on the genospecies of bacterium. But it is one of the most common indicators of an early Lyme disease infection. But this also comes along with flu-like symptoms like fever, headache, joint pain. So in that June, July, August period, when ticks are active, if you have these symptoms and you know you've been in a tick risky area, it's a good idea to see a healthcare provider. Because it's really important to diagnose early in order to get effective treatment to prevent some of the longer-term symptoms. So those include symptoms related to early disseminated disease. You might have multiple rashes, or you might have infection of the large joints leading to arthritis, or neurological or cardiac complications. If it still goes untreated, this can go to later stage disease, which can have other types of neurological and more severe complications. So again, very important to diagnose and get treated early. So you may have heard that Lyme disease is emerging in Canada, and this is true. This is something that we've seen in the data that we've been analyzing, and there are a number of reasons that this is occurring. So one of them is climate change, and you might ask, well, how does climate change cause something to emerge? Well, the warming temperatures are allowing the northward expansion of tick populations. because cold temperatures that normally would have limited their survival and their ability to overwinter are now getting warmer and permitting ticks to establish in different parts of Canada. We also have transportation of ticks by migratory birds every spring that are coming up from endemic areas in the United States and in southern parts of Ontario, bringing more ticks further north. And if these ticks are able to survive and reproduce, then we can have more Lyme disease. Similarly, we have different types of ecological factors that are causing the expansion of white-footed mice and white-tailed deer because of fragmentation of forest land, expansion of urban areas, changes to biodiversity. So it's a complex interplay of different factors. So every year, Public Health Ontario puts out a Lyme disease risk areas map. I don't know, has anybody seen this map before? They publish it every year on the website. It's helpful in terms of determining broad areas where ticks may be present in the environment. So these yellow areas, you can see the outline of Southern Ontario, Ottawa is here. And what's key with this map is that the entire health unit of Ottawa is a risk area for ticks and for Lyme disease. So just a little bit about some of the trends that we've seen in Lyme disease. This is in Ontario, and the bars are the number of cases. And you can see the scale here, and this graph goes from 2014 to 2023. And you can see the growth in the number of cases over time in the province. In terms of the seasonality of cases, I mentioned that those nymphs are active in June and July, with the adults more active in the fall and the early spring. While the peak of cases generally occurs in the summer months as well, in July especially, after people have potentially been exposed to those nymphal ticks. So this is really the risk period that we need to be aware of. In terms of age and sex distribution of cases, we typically see a bimodal distribution. So we have more cases in younger children, ages 5 to 15, and in older adults above 55. So oftentimes people say this is the grandparents and the kids going out to play in the woods, but really relates to tick exposure and different activities that might put people in contact with ticks. And in terms of the sex distribution, there are slightly more cases in males than females, again, potentially due to occupational or recreational exposures, but it really varies by age group. So in terms of Ottawa, we're seeing similar trends as we do in the rest of Ontario, with a growth in the number of cases over time. And now we'll talk a bit about some of the local tick research that we're doing in our lab. So one of the studies that we started in 2017 was funded by the Public Health Agency of Canada. And here we really tried to identify locations in the city where ticks might be established. So here you can see a map of the different sites that we sampled across the city of Ottawa. We sampled in urban sites, suburban sites, and some rural sites as well. The way that we do this is through what's called active tick surveillance. So our teams go into the field. We use a drag sampling method using a flannel sheet, which we'll show a bit later. The ticks that are collected are brought back to the lab for identification and for testing. We extract DNA from the ticks, and we look for different genetic markers of Lyme disease and other pathogens. So what we found during this 3-year study with sampling every fall and spring was that the highest tick densities were located within the Greenbelt zone and neighboring regions, and in the suburban and rural areas in the western portion of the city. So the size of the circle here is proportionate to the number of ticks that we collected. And the red dots are proportionate to the infection rate of those ticks that we collected, infection rates with the Lyme disease bacterium. So several of our sites, we found prevalence of infection in these ticks of more than 30%, so about 1 in 3 ticks being infected. And this applies to many of the sites that we sampled, particularly in the western portion of Ottawa. Why the western portion, you might ask? Well, we have a lot of contiguous areas of forest in western Ottawa. Eastern Ottawa tends to have a bit more agricultural land cover and a bit smaller forest patches. So we do have a very healthy deer population in the western part of Ottawa. We also have a migratory bird corridor that runs along the western side of Ottawa, which brings a lot of ticks into the region as well. So what we did with the data is we classified these by the degree of tick establishment. So did we find more than one stage of tick in a given location? And did we find multiple years where we found ticks? And those that are indicated in red here are those where we call high stable populations. So year after year, we're finding reproducing populations of ticks. The orange and yellow areas were emerging or low stable, and the green areas where we had no ticks that we were finding.
I'm assuming that's just the sample sites, and that, if we look at it for Kanata North, we can assume it's all fairly high density.
Yeah, in terms of, these are just our sample sites. So we do have some modeling that filled in the gaps a little bit, and it's very high distribution here. So I'll just ask if you save the questions to the end, and then I'll try to get all the questions at once. So this is just to give you an idea of the distribution of ticks around the city, and that's why we chose some of the neighborhoods in this western area of Ottawa to do our Uptick project. So this is a model, what we call a habitat suitability model, where we can see the predicted suitability for the tick species, with the red areas being high and blue areas being low. And you can see this area of Ottawa in the western region is quite highly suitable, as well as the corridor down towards Kingston. So these really the hot spots for Ontario, here in Eastern Ontario. We've done other analyses linking these models to human disease data, for example, and found that human Lyme disease incidence is associated with increasing rural areas, presence of ticks in the environment, obviously, lower population density, higher proportion of treed land, and higher socioeconomic status. So there are different factors that combine to determine whether an area is prone to have more Lyme disease cases. So our Uptick project has been doing some work in Kanata Lakes and the Stonehaven area of Kanata, Carp, Stittsville in our first phase, as well as some neighborhoods in the eastern portion, Blackburn Hamlet and Finley Creek for the last few years. And so that's why we wanted to come out and present some of the preliminary results back to the community, so that you're aware of some of the tick findings in your own community. So this is a project, again, that was funded by the Public Health Agency of Canada. It was through their Infectious Disease and Climate Change Fund. Our first phase of funding was 2019 to 2023, and we did field sampling in 2020 and 2021. Our second phase was 2023 until next year in 2026, and we have done some sampling in 2023, 2024, and this will be our last year of field work. The aim of this study is really to characterize the environmental risk for tick-borne diseases in these types of peri-urban settings in order to inform strategies to reduce public health risks. The title of the project is Best Practices for Urban Planning in the Context of Climate Change and Emerging Tick-Borne Diseases, recognizing that this kind of urban expansion, urban development is really changing the ecology of tick-borne diseases, and also potentially putting people at higher risk of exposure. So this is a map of the neighborhoods that I had mentioned. In our first phase, we had Carp, Kanata Lakes, Stonehaven, and Stittsville. In our second phase, we wanted to expand further to the east. So we've focused on these three neighborhoods and then added in Blackburn Hamlet and Finley Creek. And in each neighborhood, we sampled 3 different zones, a natural wooded area, so deep into the woodlands where we have paths and trails, an interface zone, which you could think of as the forest edge or the woodland edge between residential backyards and the forest, and the residential zone. So I'm going to pass it over to Roman, who can explain a little bit more about the sampling locations here in Kanata North and some of the methods.
Thank you, Manisha. In each neighborhood, our sample sites are situated along a gradient of open development, including the following 3 zones. This is woodland zone, natural wooded area, second interface zone, established residential woodland interface, and residential zone within neighborhoods, residential yards and trails. All 3 zones, woodland interface and residential, represent different stages of woodland development and connection to green space across all study neighborhoods. Especially in Kanata. In Kanata Lake, we have also 3 zones. The first woodland zone located along the Kizel Pond area is the forest where we conduct tick dragging. Interface zone is along the trail just to the residential backyards that border to the forest. And residential zone, it's on the trail, partially located behind backyards and across Kanata Avenue in Judy Layton Park. To achieve our primary aim, which is to assess the peak change on ticks and tick population and tick disease transmission, we conduct tick surveillance and small manual assessment in each zone of each neighborhood. Now in more details for each activity. We perform active tick surveillance using a drug sampling method. We drag 1 square of white flannel over the ground in stops in about every 25 meters to check the flannel for ticks and to turn any attached to it. We visit each neighborhood and check all 3 zones bi-weekly between May and October. For wildlife for sampling, we perform small mammoth sampling, small mammoth checking in each neighborhood in the peak period of mammoth activity from July until the middle of August, and using live traps, session live traps. And especially we target whitefoot and deer mice, which is a patent reservoir for Lyme disease causing specters, Borrelia and butterfly. From each mouse, we collect air patch, which is allow us to estimate the rate of infection with tick-borne pathogen present in the natural environment. We release mice to the forest afterward. For all kill samples, ticks and air patches for mice, we test in our lab using qPCR, responsive polymerase chain reaction, for detection of Borrelia butterfly and Borrelia miyamotoi that are 2 pathogens that cause Lyme disease and hard ticks relapsing fever. We also test samples for Anaplasma fluxaphidium, this causes agent for human anaplasmosis. We also test samples for Babesia species and for Pavlov virus. Under phase 2, we added, under phase 2 of the Uptick project, we added population survey and consultation with community members and project stakeholders to collect more data from Ottawa residents about their knowledge of tick-borne disease, about using preventive measures and others. Okay, now I'll pass to Dr. Kulkarni to talk more about Lyme disease results.
Okay, thanks, Roman. So some of our results, the number of ticks that we've collected in the last 2 sampling years across the different study neighborhoods. So here, the orange line is Kanata North, the blue line is Stonehaven, the gray line is Carp Hill, yellow is Finley Creek, and the darker blue is Blackburn Hamlet. And this is sampling from the start of May until October in 2023. And so you can see over time, there's a fluctuation in the number of ticks that we collect. We tend to collect higher numbers in the springtime when those adult ticks are active, and into the June, July period when the nymphal ticks are active. So Kanata North, our sampling area that Roman described up by the Gazelle Pond, and nearby trails tends to be the area where we're finding the highest numbers of ticks, the highest densities of ticks across the 5 neighborhoods that we sampled in Ottawa. We found similar trends in 2024. This is where we had a very warm early spring, and so we had higher numbers when we started at the start of May, and these fluctuated again over time with a bit of a peak of nymphal ticks again in June, July. We did find quite a few larval ticks last year in the late summer, and then the adult ticks again in the fall months. So if we look within each neighborhood by those 3 different zones that we described, the woodland zone, the interface, which is that forest edge, and the residential zone, we can see an interesting pattern. So these are the different neighborhoods. The W is woodland, I interface are residential. So we typically see much higher numbers of ticks in the woodland zones of each neighborhood. In some of the lower density neighborhoods, we only find ticks in the woodland zones, with lower numbers in the interface and very few, if any, in the residential. Now, the green bars here are the number of negative ticks for Borrelia burgdorferi for the Lyme disease pathogen, while the red is the positive ticks. So we can see in some areas almost 30% of these ticks that we're collecting are infected with Lyme disease pathogen, particularly in the woodland zone, but also in the interface zone, and in some cases, a few ticks in the residential zone. So this is less than 20 ticks across the whole sampling season, so very low numbers. We might get 1 or 2 every outing, but they are potentially present in these zones. Similar pattern we saw in 2024 across the different neighborhoods and within the neighborhoods as well, with highest numbers in the woodlands, but substantial numbers in the interface as well. So what we've determined from our first phase of the project, and that the same patterns that are coming out now from the second phase of the project, is that Lyme disease transmission between the ticks and the mice. We didn't show the data for the mice, but we're seeing very similar patterns with higher numbers of infected mice only in the woodland and the interface zones. We do find mice in residential zones, but they tend not to be infected. So we're really seeing that the transmission in nature between ticks and mice is happening in these woodland and interface zones within all of the different study neighborhoods. When we looked at analyzing the number or the density of infected ticks across these different zones in our first phase of our project, we found that interface and woodland zones had 15 to 20 times higher the number of infected ticks compared to residential zones. So these are really the areas of concern when it comes to potential exposure to infected ticks. And in these areas, about 25 to 35% of the ticks might be infected at any given time. So trails and pathways in these woodland and interface zones do pose a risk of Lyme disease exposure to people as well as pets. And while we see that the risk in terms of the number and density of infected ticks is really highest within the forests, in the woodland zones, that these interface zones or the forest edge tends to have higher use by residents in the types of trails and the usage of those trails, and might result in greater human tick exposure. So we really need to be aware of tick prevention and different methods to prevent tick bites, when we're out in these areas. So our project has an Uptick Community Advisory Committee, and we're here today at the request of our partners at Kanata Lake Community Association to help improve and increase awareness about ticks in the environment and how to prevent them. And that's one of the reasons that we're here sharing our research. So I wanted to talk a little bit about Lyme disease prevention. And we have some resources at the back, some flyers, and we'll provide some other links that you can go to for more information. So how can you prevent a tick bite? Well, obviously, if you're working or walking along trails in some of these tick risky areas in woodland zones, for example, or even along the forest edge, or if you're fortunate enough to have a yard that backs on to natural areas, ticks could be in the margins of your property as well. So those are areas to be aware of if you're gardening or working in your yard. So wearing long pants, long sleeved shirts, shoes, and socks to cover exposed skin. You can do things like wear permethrin treated clothing, which is sold at some places like Mark's Work Warehouse now. They have insect shield clothing, which incorporates an insecticide that will repel or kill ticks and mosquitoes, which is quite useful. If you're on the trails, really important to, if possible, stay on the trail. Try not to brush against the undergrowth or any branches that may be overhanging the trail, because these could have ticks that are questing. It's important to note that different times of day are more preferable for ticks to quest, so they don't like to get too hot because they can dry out very quickly. So they tend to be active at cooler times of day, earlier in the morning and later in the evening. So these are particular times that you might want to be careful. But of course, if it's a shady area, they might be out in the middle of the day as well. You can apply an improved Health Canada approved insect repellent that contains DEET or acaridin, which works quite well against ticks. After you've been out walking in the woods or along one of these trails, you can do a full body tick check on yourself, on your children and your pets, and remove ticks as soon as possible. You can do this by grasping them with some fine tipped tweezers and trying to pull directly up, trying not to twist or squish the tick to avoid it having mouth parts that break off into the skin or causing it to, for lack of better words, regurgitate the contents of its stomach into you and cause a greater risk of infection. And then clean the area with soap and water and seek, potentially, if you've been exposed and the tick has been attached for more than a day, seek post-exposure prophylaxis. You can receive that now at pharmacy or through your healthcare provider, which you might be eligible for to help prevent infection. You can also reduce the risk of ticks coming around your home by keeping the grass mowed short. So as I mentioned, ticks tend to dry out very quickly. So they like to be in more vegetated areas that have leaf litter, fallen leaves, or other types of vegetation. So by keeping the grass mowed short, you reduce the likelihood that ticks can survive there. So also by removing any brush and fallen leaves from the edges of the property, cleaning up under bird feeders, for example, to prevent mice and chipmunks and other small mammals from coming into your yard that might be carrying ticks. Discouraging deer from entering your yard, for example, by fencing. And it's been suggested also to use a barrier of wood chips or rock or gravel around the yard between the forest and the zone where you're most active in order to prevent ticks from migrating out into the yard. And so this is one of the intervention strategies that we've been working on testing in field trials around Ottawa. So I really want to thank you for coming out and hearing a bit of information about our research project. And I'm happy to answer any questions about the project, and then I'll pass it over to our next speaker. Yep.
At the beginning, you said we need to worry about black or deer ticks. So are you saying that dogs don't during Lyme disease?
That's right. Yes. So the dog ticks are not vectors of Lyme disease. They can be vectors of other types of agents, but they're not typically prevalent in this region of Ontario. Yeah. There's a question here that I missed before. Do you have a question still? No? If you think of it again, let me know. Yes, at the back? So these same ticks can bite cats, and we do have a veterinarian here that'll be able to give us a bit more information about our pets and how to protect them as well. Yes?
Do all ticks take 24 hours before they're engorged, or how does engorgement matter?
Yeah, no, that's a good question. So the different life stages take different times because the nymphs are so small, they can stay attached for maybe 3 to 5 days, whereas the adult ticks can stay attached for almost a week before they become fully engorged. So again, it's within that first 24 hours that there's less probability of them transmitting the Lyme disease infection. There are other tick-borne pathogens that can be transmitted more quickly, though, so it is important to try to take them off as quickly as possible, and then to monitor yourself or to go seek advice, health advice.
So are you saying that if a tick is not engorged, it's most likely an adult one, that it has not been 24 hours?
Most likely, yes. Yeah. So that's one of the things that we do look at when we receive ticks in the lab, for example, when we used to do passive surveillance, is if they're flat and not engorged, they're usually uninfected. Well, they may be infected, but they haven't passed on the bacteria. Yes?
And some samples we can pass it to you, and you can just look for all.
Yeah, we'll pass around some tick samples. They're very dead, don't worry. Yes, in the back.
Was on your clothes, you didn't realize how long were this live. Like usually I throw my clothes in the laundry, they're dry out and I come in.
Yeah, that's great.
Sometimes one of the bites I got, it may have been on my clothes and then it was on my bed.
They can live for a couple days. Yeah. So throwing them in the dryer is a great idea. That's one of the ways that you can, yeah, you can kill them quickly. Also then trying to take a shower quickly to remove anyone that hasn't been attached. Yeah. That is a great question. So we didn't provide the link here, but you can submit a photo of the tick online to a platform called eTick, etick.ca, and that will help to identify the tick and provide a bit of advice in terms of public health advice. You can keep it in a small container and bring it with you to your healthcare provider so that they can see what type of tick it is as well. And that'll help to let them know what type of risk there might be.
Thank you so much. For now, we just pause and we'll get our next speaker to talk. And after that, we'll take more questions. Also, we have our vet talk, and then we'll take more questions from everybody. Thank you so much. Okay. I want to invite Mahamed Elhalawany. He's a pharmacist here in Kanata North Pharmacy. And he's going to talk to us what's happening once you got bitten by the tick.
It's about the danger that ticks present to our pets, dogs and cats. And maybe some people here might have also horses. One of our associates, Dr. Elhalawany, she has a horse, and she shared with me information that all of her horses have been diagnosed with diseases that are transmitted by ticks. In the neighborhood, she lives in Nairobi, which is very close. So there are several species, as Professor Kulkarni said, available in Ontario, but the most important one are those that carry the Lyme disease.
The buttons at the top.
Okay. Very simple, but I believe you can see. So there are several species that are available in Ontario, and the most important are the one that carry the Lyme disease, like the black-legged tick, and it carries Vetrinarian, which is the Lyme pathogen, and we also see a lot of anaplasmosis. Anaplasmosis is a disease that's caused by a microorganism, the two common one, Anaplasma platis and Anaplasma phagocytophyllum, as Mr. McKay mentioned. And I believe recently we see more anaplasma than Lyme disease. And probably the reason for that is because most of the dogs are protected by certain type of medication to prevent tick bites. But the Lyme disease takes probably 24 to 48 hours in dogs to be transmitted by the tick. And if the dog is on any kind of oral tick protection, the tick will die and won't be able to transfer the disease. But anaplasma is transmitted within half an hour to 1 hour. And even if the tick dies after it bites the dog, then the dog may be infected. There are also some ticks that are available in Ontario. Professor Kulkarni will correct me if I'm mistaken, that carry other diseases like tularemia and Rocky Mountain spotted fever. We haven't seen it yet. We just see a few cases, very few cases of something called Elhalawany, but all those dogs came from the Caribbean and from warmer countries. We don't have Elhalawany as endemic currently in our area. We don't see it. The most common we see is anaplasma and Lyme disease in dogs. Professor Kulkarni and Mr. McKay briefly mentioned about those the bacteria causing Lyme disease. This is probably 1,000-time magnification. This is how the bacterium looks like. The anaplasma is not shown here. What can we do to prevent our pets from getting exposed to ticks? I want to mention to everybody here that there are so many bogus products, so many false products that are being advertised online, and don't fall for that. Don't go for the next door neighbor garage type of product because they don't work. They put everybody at risk, pets and humans as well. Don't use such products. Speak to your veterinarians what the best options are. Like there are some other repellent type of products that act by repelling the ticks. They also repel insects like fleas and mosquitoes, but they don't have such a good duration of action because they're topical products, and over time, if the duration of action, for example, of topical products, including Advantix 2 that is available at pet stores and some veterinarians, it can get washed off. The labeling is for a month, but say you take the dog to the groomer and the groomer gives a good bath to the puppy and the product's no longer there because it does not penetrate the skin. It stays on the dog. It's a repellent. So most veterinarians now recommend oral medication. Those are different groups of medication that are eaten by the dog and they get into the bloodstream. They get absorbed in the stomach of the dog and they get into the bloodstream. And those act on the tick when the tick bites the dog. And here we come with the anaplasma and Lyme disease transmission. Lyme disease is being transmitted with difficulty by the ticks because the tick will die soon enough before it's able to transmit the disease. Whether the anaplasma is a little bit faster, and even if the tick dies after it bites the dog and gets the medication from the bloodstream of the dog, will still be able to transfer the pathogen anaplasma. What we do is we put our dogs on prevention, tick prevention with a topical medication like Advantix or the other products that I briefly mentioned, or somebody can already have their dogs on oral medication. But we need to check everywhere because dogs are more prone for roaming. A puppy will go to the bush. Humans stay on the trail, but puppy will run. When you take a puppy to the dog park, they will go to the forest, they will explore, they go to anything, and they will attract lots of ticks. And those are common sites that where we check for the dog, if the dog's been exposed or if there are any ticks attached to the dog that may need to be removed. And the recommendation for removing is to seek the help of a licensed veterinarian to remove the tick because some people try to remove it themselves, but it carries a risk if the tick is infected with certain kind of pathogens, anaplasma, etc., or by Lyme disease. With bad hands, people risking getting the infection. We don't want to experiment with that. So the best thing is speak to your veterinarian to get the tick removed, and you can get professional help from the veterinarian. Cats are also exposed to ticks. Some cats go outside. Most of our cats stay inside during the colder months, and they, or probably 100% indoor cats, but kittens that go outside will get bit by ticks. They get ticks. So we also have medication, and medications available for ticks. And this particular plant is something that is applied topically, but it penetrates the skin of the cat and will get into the bloodstream. So if the cat is exposed to a tick bite, if a tick bites the cat, it will kill the tick. Okay, so no pathogen can be transmitted to the kitty and make the cat sick. What happens if the dog gets bit, if your puppy gets bit by a tick? Speak to your veterinarian. There are many tests available, and this is one of the most popular. A snap test which checks for 4 different diseases, vector-borne diseases. One of them is heartworm, which is carried by mosquitoes, and is not the topic of the presentation tonight. It's more for the diseases that are carried by ticks, like anaplasma, Lyme diseases, and Ehrlichia. Spelling of Ehrlichia is very difficult. Ehrlichiosis, it's a German scientist who first described the microorganism. And if a dog has been, if you find tick on the dog and the dog been exposed to ticks, usually within 4 to 6 weeks, the recommendation is 4 to 6 weeks, you seek the help of the veterinarian to do that test. Okay, so to determine whether the dog's been infected or not, because often we see dogs being bit by ticks, and they are just not carriers of any of the pathogens. And the puppy may be lucky, but next time, there will always be next time. Dog may not be as lucky and may be infected with one of those diseases. The other thing is, I just wanted to mention briefly about the Lyme disease and the anaplasmosis, the most common that we see in the area that are transmitted by ticks. There is vaccine against Lyme disease that your veterinarian can discuss with you for your dog. It's specifically for dogs. It's not available for cats. And the purpose of the vaccine is to boost the immune system of the dog. So if the dog gets somehow infected with Lyme disease, the immune system of the dog is able to keep that bacterium at bay, because once infected, the dog will carry the bacterium for life. It will not be possible to eliminate 100% the bacterium, and we try to prevent the clinical symptoms and to make sure that the dog stays healthy. So this is why the recommendation is vaccinate the dog against Lyme disease. And the 2 most common questions we hear at our practice, and probably the other clinics in the city, people are asking, why should I vaccinate against Lyme if I give tick prevention to my dog? And vice versa, why should I give tick prevention if I vaccinate against Lyme? And the answer is because it takes one tick to transmit the Lyme disease. And for example, if the medication available that your veterinarian will recommend and prescribe for your dog, if the medication has 95% efficacy and will kill 95% of the ticks, if a dog gets bit by 10 ticks, 9 will die, but the 10th one may survive and transfer the infection. This is why it's kind of a double protection. Do something for ticks, vaccinate against Lyme disease. The other microorganism, anaplasma, we don't have vaccine for it. And what is happening, the veterinarian will recommend further treatment if necessary. We do not always treat dogs against anaplasmosis. Don't put them on medication, because if we determine the dog's been infected with anaplasmosis, it doesn't mean the dog is sick. It just means that the dog's been exposed to the infection. And the good news is dogs are much more resilient and more stoic against those diseases than humans. Humans are much more susceptible to Lyme disease. I would be happy to answer any questions. Dr. Child has a question about the kitty, protecting kitty from. You wanted to ask about the cat protecting your kitty from tick bites? I'm not sure. Okay. Yes, sir. Yes.
If you had an animal that had anaplasmosis or Lyme disease, would you know? Would there be any clinical signs?
Most of the time, no. As I said, they're much more resistant to those infections, and very often we don't see it unless we test them for the disease. This. Okay.
Thank you so much. And so now Mohamed is a pharmacist from Kanata Pharmacy, and he'll discuss what happens once you get with them. We'll take all the questions for any of our speakers at the end.
Hello there, I'm Mahamed from Kanata Pharmacy. Thank you very much for having me tonight. I would like to present some information. If you are bitten by a tick, you go to the pharmacy. Sometimes you wait a little, you discover it a few days later. We're going to discover what the pharmacist can help you with. So I do thank Professor Kulkarni for having very informative information, and as well, thank you. So let me start here by the contents of the presentation. Well, I will skip the part of the tick. I will go directly to assessing and referral. You've seen these before. And this is the engorged ticks. Now the assessment. Where can you find it? So you can see the rash here. It's called erythema migrans. It's very famous. If this happens, so if your child, if yourself, you have this erythema migrans, that's a sign of Lyme disease. You go to the pharmacy the next day, the same day, the pharmacist should tell you, go see your physician or go to the ER. That's a red flag. It means that Lyme disease is there. That's very easy. Or else, if you have the symptoms, fever, chills, usually flu-like symptoms, if you have them, that's a risk factor or like red flag. Then if you have the serious ones, the stiff neck, this is unusual for the flu or for the cold. You have stiff neck, if you have any swollen lymph nodes, decreased appetite, all these are really important signs that there might be Lyme disease. So whenever you go to the pharmacy, or perhaps you tell a friend about this, you need to go to ER or visit your physician as soon as possible. Well, the physician, what he will do, he will give you the treatment for Lyme disease because it is Lyme disease. So he'll give you 21 days of antibiotic treatment. This will prevent the consequences of Lyme disease. That's what Professor Kulkarni talked about. So that's why we say refer to the physician or the nurse practitioner. They can prescribe you the 21 days of antibiotic. And then you will prevent, or hopefully prevent, the long-term consequences of Lyme disease. The bacteria will continue to be in your blood, in your system, so it will infect your lungs, it will infect your brain. Well, let's not be so sad. So it might infect the person's lungs, brain, the heart, the muscles, the nerves. So it's pretty bad if it happens, and it will continue to affect the person for years. So it's better to take it serious. And when you have the signs, go see the physician immediately. The pharmacist will have to refer you to the physician, and then the physician will give you the treatment for the Lyme disease. Maybe they will send you to do lab work, but potentially they will give you the prescription. So now, after the assessment, is the patient at high risk for developing Lyme disease? So, which means that the person doesn't have the rash. He doesn't show any symptoms. There are no symptoms. So what to do? He has seen a tick. He's been bitten by a tick, or maybe he has seen a tick crawling on his clothes. What do you do? So we have, if you go to the pharmacy, you will have to ask you these questions. When was it? Like, when did you last time went to a park, played with the kids, or went to on a trail? So we have to watch the time, monitor the time. So 72 hours. If it's more than 72 hours, I don't think we can help. Then monitor the symptoms, but it has to be within this range. The second, did it happen in a high-risk area? Well, Kanata is a high-risk area. So anywhere in Kanata, that's a high-risk area. And all ticks are potential suspects. They might be the black-legged ones. So was the tick likely attached for 24 hours? So we don't know. So was it yesterday? Then it's a 24-hour thing. Was it 2 days ago? Was it the last weekend and you discovered the tick attached to the tummy or maybe in clothes? We don't know. But these are the questions. The last thing is that the only antibiotic the pharmacist can give is doxycycline. So is it contraindicated in your case? Very few cases that doxycycline will be contraindicated. Children 6 months old can take doxycycline. Adults can take doxycycline. Pregnant women can take doxycycline. Lactating women or breastfeeding women can take doxycycline. So you can take a prophylaxis dose, and it's only one dose. So in order for the pharmacist to prescribe doxycycline, you will have, well, the person has to meet all these criteria. It's been there for 72 hours. The event of the encounter with the tick has been there for the last 72 hours. Not more than that. It's not in the last month. It has to be this high-risk area, which is Kanata. Tick was likely attached for 24 hours, and then the contraindication. The contraindication, the only contraindication to doxycycline I'm aware of is the hypersensitivity. So a person who took doxycycline before developed anaphylaxis or potentially a rash, then we do not prescribe. There are other options, but the pharmacist cannot prescribe them. It has to be referred to the physician. So if all the 4 criteria are not met, then do not prescribe the antibiotic and educate the patient to monitor for the symptoms. So anyone, whether he took a prophylaxis dose, he did not, he discovered it early or late, you will have to monitor yourself for symptoms for 30 days. So let's say it happened last weekend, and that's the time it was Sunday, let's say May 1st, then continue to monitor it for 30 days. It's very important to mention this part. I always tell patients that if you go to the physician or a nurse practitioner with a child that has fever, the healthcare professional will just say, wait for 3 days. It might be the flu, it might be a cold. But if there was a tick and there might be an encounter with a tick in Canada or maybe in Ottawa, consider it might be Lyme disease manifestation. So the doctor would say, go sleep on it for 3 days. Please mention to the doctor that there was an encounter with a tick and it might be Lyme disease. It might not be a flu. Then the doctor will be able to investigate a little bit further to make sure he's doing the right decision for you. So what is the prescription? What your pharmacist can do, he can give you 1 dose of prophylaxis, which means that you do not have the erythema, the migraines, you don't have these symptoms, but you have an encounter with a tick. So only 1 dose of doxycycline would reduce the likelihood of Lyme disease consequences significantly. Only 1 dose for adults, 1 dose for children. The same medication can be prescribed by a pharmacist. You don't have to wait 10 hours in the ER to get this. So I have these videos, but I don't think they will work.
If you find an attached tick on your body, here's how to properly remove it. You'll need clean tweezers. Fine point ones work best.
Well, this would take about 3 to 4 minutes. Would you be interested in showing it, seeing it? Sure. Do you have any children here? So let me start by this one.
When you go outside, you might find a tick. That's a type of bug that can make you sick. Ticks are very tiny and look like small black dots. Look very carefully. They're hard to spot. Before you come inside from an outdoor trek, here are the top 10 tick hiding spots to do a tick check. 1. Check your head and then your hair. 2. Check in and around your ear. Ticks can hide there. 3. Check your back. Ask for help, as you might not be able to see. 4. Check under your arms where ticks might want to be. 5. Check your shirt and then your chest. 6. Check your hips and waist for an uninvited guest. 7. Check your belly button. Lint might not be all you find. 8. Check your pants and between your legs. Ticks can hide there. They don't mind. 9. Check your legs and look behind your knees. 10. Check your feet and between your toes, please. Now that you've checked your body for a tick, check your pets and your gear so you don't get sick. If you find a tick on you, always give a shout to an adult that you trust and they'll get it out.
Okay, that's approved by Health Canada. Okay, so now let's get back to. I'm skipping the American videos. I'm going to the Canadian one. So.
If you find an attached tick on your body, here's how to properly remove it. You'll need clean tweezers. Fine point ones work best. You can also use other tick removal tools, but we'll show you how to remove a tick with tweezers, a common household item. You also need soap and water or alcohol-based sanitizer. Being in a well-lit area or using a magnifying glass may help you to see better when removing a tick. If you are not comfortable removing a tick or cannot reach it yourself, ask another person to help you as soon as possible. Start by grasping the tick at the head, as close to the skin as possible. Take your time and slowly pull it straight out. Try not to twist or squeeze the tick. Once removed, wash the bite area with soap and water or an alcohol-based sanitizer. Place the tick in a sealed bag or container. Take a photo of the tick and record the date and location as well as the part of your body where you were bitten. This information could be useful if you need to see a healthcare provider. Don't try to remove the tick with nail polish or nail polish remover, petroleum jelly, heat, or essential oils. These methods can damage the tick and increase the risk of infection. Preventing tick bites is the best way to protect yourself and your family from Lyme disease and other infections spread by ticks. To find more on how to reduce ticks around your home, how to do a proper tick check, signs and symptoms to watch out for, and more, visit canada.ca/Lyme disease. A message from the Government of Canada.
How about another one?
Ticks can carry Lyme disease. Sometimes a tick bite can make you sick. You can prevent Lyme disease by doing a full body tick check, which allows you to find and remove ticks before disease transmission. Do a full body tick check on yourself and your family after being outdoors where ticks may be active. After being outdoors, do a full body tick check as soon as possible and before going to bed that day. A tick can bite anywhere on the body, so it's best to remove your clothes before doing a tick check. Check for ticks and tick bites from your head to your toes. Look and feel for bumps and small dark spots, 1 to 5 millimeters in size. If a tick has been attached to the skin for a few days, it can swell and look brown or gray in color, like a new skin tag or pimple. For those hard to see places, use a mirror
or ask someone else to check for you. Be sure to check ticks' favorite hiding places. If you find a tick, remove it as soon as possible by following these steps. If you find one, there may be more, so make sure to finish checking the rest of your body. Submit a photo of your tick to etick.ca to get more information about the tick. For more on Lyme disease and ticks, visit fmhu.org/Lyme.
Thanks so much for being so patient. And now that's a take-home message. So it looks scary, it looks awful, but have a plan. So don't panic, have a plan. If you have a tick, that's okay. This is fine, no problems. In other places, in Canada and in US, ticks like flies. It's everywhere. So have a plan. Start by prevention. So when you're planning your trip into a wooded area, it's better to cover your skin as much as possible. Use insect repellent, like what Dr. Kulkarni said. And if you can see anything here, it's very important to monitor the time. So when did this happen? When did this start? And then get the time. If you suspect you have been bitten by a tick, or you have seen a tick, you've seen it crawling on the scalp, behind the ears, anywhere in your body, consider it has bitten you and call your pharmacist. And of course, even if the pharmacist gives you the prophylaxis, even you are healthy and nothing happened, monitor yourself for 30 days. It's very important. Monitor yourself, your loved ones, and maybe the pets for 30 days. And that's it. Enjoy your summer. Thank you very much.
So if the tick lands on you, how long before it starts to embed?
Your body, how long does it take? It can crawl around for several hours. So we generally say within half a day, it usually finds a good place to dig in. But that's why if you've been out on a hike, if you come home, throw your clothes into a hot dryer and have a quick shower, that can wash any ticks off that might not be attached yet. When my kids were little and we were out in ticky areas, we would put them in the swimming pool in the summer. So, or a quick bath, right? Just to wash anything off. Yep, the back.
How effective is a hot shower, and how long should it be?
Oh, I don't know if there have been studies looking at the length. It's not the heat, it's just the physical act of washing the tick off that has not embedded yet. If it's attached, the shower won't remove it. But it's a good place to find a tick if you're in the shower anyways. Yeah.
My experience, I've had a couple tick bites. I do have Lyme disease. Is that the first bite I had, it was only within about 2.5, 3 hours when the tick had latched itself on, because I didn't realize it was the tick. I thought it was just another mosquito or something. And I realized, but it was in there, but it would have only been 2.5, 3 hours from the time it had gone out to the time I came in.
Yeah. So, I mean, they can find a spot immediately. It really depends. Often if they attached or they were on your pants, they'll crawl up under your pants, for example. Once they hit your belt line, that might be where they stop and decide to. Yeah.
So how effective are the other options besides DEET?
Like natural products, you mean? Or
Like I read that 50% might kill them.
there are some essential oils that are toxic to ticks and can kill or repel them. The challenge is they're not regulated, so you don't necessarily know the concentration, and they wear off really quickly. And so you would need to reapply them frequently. So that's what the assessments we do of natural products in the environment. It's the same thing. They can work immediately when they're applied, but they degrade very quickly, so they need to be reapplied, which is why DEET and Acaridin are currently the only two Health Canada approved insecticides that work against ticks.
For humans.
For on humans, yeah, they're livestock and
The
insecticides.
permethrin, I think, works pretty good.
Permethrin, and you can get permethrin treated clothing for humans now. It's just not approved for. You can't import the permethrin. You can only buy the pre-treated clothing.
When you said that the different counting for both, and they're smelling and the temperature, do you know what temperature they're looking for and what amount they're looking for?
Yeah, I mean, that's a great question. And there's a lot of research looking at different pheromones that attract them to their hosts. But CO2, they're mostly looking for things that are breathing and things that are warm. So just warmer than ambient temperature and carbon dioxide and movement. That oftentimes they'll start questing up to the tips of the leaves. Yeah, that's when the host passes by, they'll be able to grab one. There are different tick species that are a bit more predatory and pursue their hosts, but black-legged ticks do not do that. And we don't have those ones here in Canada yet.
Do you have any strategies that you recommend for farmers to help either protect our properties, for our neighborhood? And is your research being communicated at all to any government?
Yeah, a great question. So we do work closely in collaboration both with Ottawa Public Health, with the NCC, and with the City of Ottawa. Our findings are translated to the Public Health Agency of Canada. We're also part of the Canadian Lyme Disease Research Network, and so we engage with health units across the country to share our results. And some of the intervention studies that we're working on are mostly targeting recreational trails, which is where we've been doing these studies. So we've been testing out using wood chip borders or wood chips that are treated with deltamethrin, like permethrin, which adheres very well to the wood chips and then doesn't get into the environment and affect non-target organisms. We are in the process of publishing results of a 2-year study that we did on the Jack Pine Trail and a trail out in Mer Bleu, which showed very, very good effectiveness of the treated wood chips. But even just the wood chips themselves work very well if they're applied in the springtime. So using that around your property, so keeping your grass cut short and then using a border of wood chips or gravel or some other substrate like that doesn't hold moisture too much, can prevent the ticks from migrating too far into the yard. They can always come in on small animals, but it will keep the numbers down. And it also serves as kind of a visual cue that, okay, we're getting near the forest edge, and so be a bit more careful about ticks in that area. So yeah, yard maintenance and environmental management tends to work quite well. There are interventions that target the small mammals themselves. So there's things called tick tubes. Don't know if you've seen them. They're called Damonix tubes or tick tubes. It's basically a little cardboard roll, like a toilet paper roll with cotton inside that's impregnated with permethrin. And the ticks take the cotton and go back to their nest and basically treat their family for ticks. There are other things that are little bait boxes that have an insecticide in it that's kind of like a little car wash for mice, so they get treated for ticks that you can put around your property. And then on a larger scale, there's ways to treat deer for ticks, so that can control the tick population, called 4-poster devices, but that really needs to be done on a widespread, like a citywide or a regional level. So you need the buy-in of the municipality or other landowners for that.
Natural resources, or they participate?
Potentially, yeah. Ministry of Natural Resources. It's and this is one of the challenges with tick-borne disease control is it's multi-sector, right? It's public health, it's environment, it's animal health. So we need to really be collaborating across different sectors, communicating these risks. So with the Uptick project, we're trying to do that in terms of urban planning and urban development and public health and trying to raise awareness. But certainly, yeah, maintaining your yard and being careful when you're on the trails are the biggest ways to prevent encounters with ticks. Yeah.
You're talking about other pathogens that ticks can carry. Are these other pathogens human health risk as well?
Yeah, so the ones that we listed on the Uptick project are ones that are concerns for human health. So anaplasma, which was mentioned by Dr. Oprikov, is also a human pathogen, and there has been a rise in human cases of anaplasma in Eastern Ontario over the last few years, similar to, I'm assuming, the rise in cases in dogs. Still not as prevalent as Lyme disease, for example. Other things like Babesia, Powassan virus, we're not seeing as much. Powassan is very rare. We haven't detected it in any ticks yet in Ottawa, although there has been one human case in part of East Ottawa. The Babesia, we're not seeing, there have been cases in Ontario. It just became reportable as a reportable disease last year, along with anaplasma. So now we have better data on human cases, but we haven't found it in any ticks yet, and we've tested thousands across the city.
Like the clinical symptoms, like it's pretty much the same.
So Babesia is a bit more like malaria. It's a quite severe acute febrile illness that can lead to loss of consciousness and kind of multi-organ issues. So it's quite severe, but all of these diseases tend to start with a fever, and it's quite quick onset fever. So high fever in the summer, big tick-borne diseases if you've been out in the surroundings around Kanata.
Is there a separate test for anaplasmosis, or is it the same that if you go for a Lyme disease test, blood test, will it pick up the other, or do you have to have separate?
They would be separate tests. In humans, and correct me if I'm wrong, it's all serological testing typically. So they're looking for antibodies, which is why the test wouldn't really become positive until about 4 weeks after you've been infected. We don't have very good tests for early infection. Those are area of ongoing research. So if you tell your healthcare provider you've had a tick bite, and they're now in a risk area for anaplasma and Lyme, they would typically test for more than one tick-borne pathogen, but they would be separate tests.
So tick tubes a danger to pets and other small wild animals?
Not really. We haven't evaluated them in our. The permethrin has a very short half-life. It degrades very quickly in the environment, so it's not something that accumulates in the environment. I know permethrin might have consequences for cats. It's toxic for cats, so if you have cats, it's probably not a good idea to use those around your property. Yeah, it has very low toxicity to most mammals. Yes.
So, in terms of practicality, are you saying that we should put DEET on ourselves every time we go for a walk, basically?
I would recommend wear long clothing, spray the repellent on your clothes, and or wear insecticide treated clothing, which is quite safe. Again, permethrin.
Really hot summer days.
I know, and that's the challenge. So that's the risk benefit that you have to weigh. Is you're going into a tick endemic area. It's probably best to wear long clothing and shoes and cover up, and do that tick check when you get back. If you know that it's a very wide trail, you're not going to be in contact with any of the vegetation. There's a very large kind of mowed area. It might be okay to wear shorts and sandals. But personally, anytime in the summer I'm in any kind of tick risky area, I'm wearing full clothing and repellent.
Because my wife and I were in Kids Pond and we were walking across the bush. We got ticks on us.
Yeah. They are out. The team was out today.
And they started in west, in all of Ottawa, and most of the ticks we found in west side of Ottawa. It's really active right now.
Yeah. So now you'll be encountering adult ticks right now, and then into June and July the nymphs will be active. So
they survive through the winter, basically?
Yes. Yeah. They overwinter. So that's why the deciduous forests are so important. They have a thick layer of leaf litter on the ground. The ticks can burrow underneath that and stay safe from the cold. Yeah, protects them.
We also recommend the aerial treatment for pets against ticks because ticks are active about all the bees. We had very cold winter this year, like January, February, but last year we had +10, +11 in January.
Yes.
Many days, so ticks would be active. And the recommendation is treat the pets
All year round. Yes.
Yes.
Yeah.
Do you mind if I add something here?
Yeah, please do.
We've seen cases with ticks in the backyards. So it doesn't have to be in a wooded area or inside a forest or on a trail. It might be your own backyard. It might be the front yard. If your dog wanders into another person's front yard, you might get a tick and come back to you. So they are very abundant these days.
Yeah.
And can also.
Yeah, birds can bring ticks
Birds.
just about anywhere. If they fall off a bird in a parking lot, that tick would survive, but it does land in an area that's good habitat for them. They can survive there and then come upon a host. So I think the key message is that ticks are out there. Be aware. Have a plan. I like that idea. Take measures to protect yourself, and know what to do when you find a tick. But don't let it stop you from enjoying nature. Obviously, there are benefits to being outdoors. It's just a good idea to have a plan. So, yeah, we'll take one more question from the gentleman at the back. Sorry, there was someone right behind you. Go ahead, sir.
Just about the plan, can we go to the pharmacist to remove it? Yeah, not comfortable.
I don't know what to say.
You can buy tweezers.
It's a good, try to remove it as quickly as possible to prevent that transmission from happening. So having a pair of tweezers handy is a good idea, and some hand sanitizer or something like that. Just before we wrap up, I wanted to note that we have a survey, a quick evaluation. If anybody has your phone handy, you can go to surveymonkey.ca/r/uptick, or you can just scan the QR code here.
Can you give me the information and we will post it with the report?
Oh, perfect. And it'll be posted with recording as well. Just fill out how you enjoyed the presentation and found the information useful. And I'll pass it back to you.
Okay, I want to thank the an informative and wonderful presentation. So thank you to all our speakers. I'm hoping you'll stay around for a picture in a minute. And thank you to all of you for all of your questions and your attention, because that really expanded the discussion. So I'm not sure if our speakers want to stay around to answer any other questions, or it is getting late. All right. Okay.
Yeah, I'd ask one of you can stick around.
I meant after we were done.
Okay.
Yeah, just come up and individually ask your question if that's okay. So thank you, everyone, and have a good rest of your evening. Thank you.